May I call upon the next speaker, Dr. Pavitra Patel.
Good morning. Just 1 second. The format is not correct. It's shifted. The things have shifted. हाँ? अभी चेक किया तो बराबर था ना, ये हिल गया पूरा।
मैं 8 बजे आ गया नीचे।
ठीक है, चलेगा चलेगा। Good morning, everyone. I'm going to present my poster podium presentation on Duoplator, a novel instrument for toric IOL alignment in small pupils. I have no financial interest. So to begin with, we are all aware of multiple preoperative and intraoperative causes of insufficient pupillary dilatation and the challenges which we face because of this, mainly which can include blind rhexis, posterior capsular rupture, vitreous loss, nucleus drop, zonular dialysis, retained cortical matter, damage to the iris tissue, and the most challenging of all, toric IOL alignment in small pupils. So how can you tackle this situation? By various methods, most common being pharmacological dilatation. But again, it has contraindications. It cannot be used in patients who are hypertensive, who have known cardiac conditions, and who are allergic to these drugs. Then we have a method of mechanical dilatation. This is a very good way to increase the pupil size, but intraoperatively, when you get a Meo's pupil post-nucleus removal, it is really a time-consuming process, and it can result in sphincter tear, and it has a learning curve attached to it. And then there is this newly launched intraocular lens marker by Dr. Sri Ganesh. Again, a very good marker, but the indentation mark on the IOL does not stay longer. So then the aim of the study was to demonstrate the applications of Duoplator, which is a novel instrument for simultaneous stretching of the pupil and toric IOL dialing in cases of intraoperative Meo's pupils. So this was a prospective interventional study which included 120 eyes of 65 patients. Now all patients undergoing cataract surgery with phacoemulsification with a monofocal toric IOL who developed intraoperative meiosis were included in the study, and all these patients had axial length of less than 25 millimeters. All those patients who had a preoperative non-dilating pupil or were known cases of IFIS, uveitic cataracts, traumatic cataracts, had known retinal pathologies, irregular corneas, were all excluded from the study. Now, the preoperative evaluation included the routine cataract evaluation, what we do for all our patients. Now, because I couldn't put the video as this was poster podium presentation, I will just show you how the instrument looks like later after the presentation. So this has a fulcrum here, which helps to push the iris, and then there is this dialer tip which helps in dialing the IOL to its desired axis. Now, because it has two purposes, it serves two purposes, the term Duoplator was coined, and all the surgeries were performed by a single surgeon. So the follow-up protocol was at day 1, week 1, and 1 month. These are the patient demographic data pre-operatively. Now, the graph 1 shows the degree of misalignment. Now, all the patients, 120 eyes, had a degree of, the misalignment was less than 10 degrees at the end of 1 month. This is a graph to post-operative uncorrected visual acuity. Again, at the end of 1 month, 112 eyes had a UDVA of 6/6, 7 eyes had a UDVA of 6/9, and only 1 eye had a UDVA of 6/12. Graph 3 showed distribution of the residual astigmatism, and all the eyes, 120 eyes, were under less than 0.5 residual astigmatism. Sorry. Now, post-operative inflammation, 94% of the eyes had shown no signs of post-operative inflammation. And the last graph shows the percentage of iris damage. Again, 95% of the eyes showed no iris damage in any form. So to conclude, this instrument saves on time. It can be used under irrigation. You don't need viscoelastic substance. It is a useful and a practical instrument with a very short learning curve, and it has a good safety and feasibility in various hands what we have studied. Thank you.
Okay, since you haven't put up the video, can you explain just in few words how do you use that Duoplator?
So basically, just 1 second. Can I come near?
No, sir.
Can I come near?
Sure, sir. As you wish.
This has two.
Yeah, understood. How do you use it?
The
Okay, since it has got a small fulcrum, if there is amount of intraoperative meiosis is more,
Yeah.
suppose if it's fully dilated, fine enough, that will hold it a little bit of iris. If the intraoperative meiosis is more, means more of iris needs to be pushed back.
Yeah.
Will it work?
Yes, the dialer tip is of 0.9 millimeters, so it works even in very small pupils. It's longer than the normal usual dialers. It is 0.9 millimeter, the tip.
So is there any chance that dialer tip may rupture excess margin? Because
There
when
is-
you are pushing iris, the dialer tip is like this and it is 0.9.
Correct.
0.9 is quite
Always
big.
there.
Correct.
Is there any chance that it will rupture?
It might obviously, but we didn't face. Obviously, you have to be a little careful while using because it's slightly longer than the normal dialer tip. It has definitely a chance of that, but being, safely, if you do it, obviously it doesn't really rupture the anterior capsular.
Complications can always occur. That is there. They are trying it. Thank you.
Thank you.